So retainers are for life. Okay. So who is a specialist who does straightening of the teeth? Orthodontist. Okay, so again, orthodontics is it's a specialty of dentistry wherein we are correcting the crowding of the teeth, and also so we're trying to fix the alignment. Okay, making sure that everything's like straight, your bite is corrected as well, facial symmetry is being corrected as well. Okay, so who is the assistant who is helping the orthodontist? Or what do you call the assistant who helps the orthodontist?
The orthodontic assistant.
Orthodontic assistant. So the good thing with an orthodontic assistant, first you need to have your license or your expanded function license to be an orthodontic assistant. With this one, you are not only responsible for just handling the instruments. You are the one helping the orthodontist really work onto your patient. So with this one, you are in direct relation with your patient. So the dentist or the orthodontist will tell you which wire you're going to use, what bracket you're going to place, and you are the one who's really going to do it on the patient's mouth. That's a good thing with being an ortho assistant. Okay. So you will notice that in an ortho assistant, can you describe your ortho office, Amy? Is it a private setting or is it an open day? A private one, meaning there's like one room for one patient. You will also notice that in some offices, for an ortho office, they have an open bay, meaning they have like one dental chair in a very big space. So there's like multiple chairs in one. So what happens is sometimes there will be like multiple dental assistants or orthodontic assistants in one practice. So let's say one orthodontist, 5 assistants. So the dentist will go to, or your orthodontist will go to one chair. They're going to say, okay, this is what you're going to do with this patient. Your assistant is the one's going to work with the patient. And then the orthodontist will move on to the next one. So in an orthodontic practice, it's not a long procedure. So normally one visit for a patient will take at least 20 to 30 minutes. So that's the reason why an orthodontist can see, let's say, maybe 60 patients in a day, because they're moving fast with the help of the orthodontic assistant. Okay, so the dentist or the orthodontist will tell the ortho assistant what to do. The ortho assistant will be the one who's going to work with the patient, and then the orthodontist will move on to the next one. And sometimes, of course, they're still going to check it, double check whatever the ortho assistant did. Okay?
You mean like what? Do you mean like performing surgery?
Which one? For the orthodont?
Assistant?
The assistant doesn't perform any surgery.
So what do you mean like work with the patient?
So let's say the assistants are the one who are going to untie the brackets. We're going to remove the elastics. The assistants are the one who's going to put the wires on the patient's mouth. So the orthodontist will tell you, okay, we're going to move to a different wire. You are the one who's going to put the wire.
So who puts the brackets on? That would be
The orthodontist.
Okay.
Sometimes the ortho assistants will place the brackets, but the orthodontist will make sure that it's correctly positioned. So the orthodontist will be the ones going to position it, and then when everything's positioned properly, then you're going to cure it. But yes, you can put the brackets, but the final thing will be the orthodontist. Okay? The orthodontist will tell you which wire to use. You're going to put it, cut it, and put it directly on the patient's mouth. So that is the orthodontic assistant's duty. Okay?